Hey friends, Dr. Mary Starr. Want to do a book review on Jaws, the story of a hidden epidemic. So I'm doing this book review on the story of Hidden Epidemic by Sandra Kahn and Paul, I can't say that backwards, but anyway, this is an incredible book, and if you struggle yourself, well, you can see my ring. If you struggle yourself with low energy, if you are a person who snores, if you are a mouth breather, do you know what a mouth breather even is or looks like? I want to encourage you to do that. But first up, I've got to tell you about our classes this week. On this Friday, I believe it's at noon, it might be 12:30, we have coming up a women health chat, myself and Karen Warman, and we are going to be talking about specifics to my journey of weight loss. We're going to be talking about the lymphatic challenge, lymphatic cleansing, cleansing the cellulite. We're going to be talking about energy things and anti-aging. So Karen's 50, I'm 47, so we're really tailoring that class to anyone who's like 40 and above, or anyone who's struggling with female issues, right? So don't miss that. We have that on Zoom. I'll get you link to be able to register for that on Eventbrite. If you are local and an acquaintance or friend of mine or client of mine, I'm having a little spa night open house here in my home. So that'll be fun on Thursday, and we'll have a few of those scheduled for Thursdays. Okay, but back to this. This is my book review. I listened to this book all weekend long. My kids and the neighbor kids are like, what are you listening to? Because if you do get the Audible version, it is a little bit dry and fast-paced and stuff, so it's like listening to a professor a little bit. But tell you a little bit about the authors. Many years ago, these two got together. They were acquaintances, friends, and they were having dinner. And she was an orthodontist, and he is written quite a bit about human, I guess you would call it epidemiology and things like that. And whenever she was saying that I can't recommend the braces that I have been telling my patients to use all these years, because that's not the problem. The problem is this serious issue that's happened with our Western society with the jaw, our jaws, which many years ago, and teeth used to be very straight, but when we became more westernized and started eating softer food, started not breastfeeding, we became what many people know as mouth breathers, okay? So if you ever see a kid or you see an individual, like a lot of times they'll breathe with their mouth open. I think I struggle with that too. And so what have we been doing? We've been taking out wisdom teeth, taking out teeth so that the teeth will fill, so we'll have nice straight teeth, but that's not the problem. The problem really is that we need to expand the jaw and grow the jaw. So this whole new, I guess you could call it science even, called Fluoridonics, right? I've done YouTube videos on healthy starts, which my kids are doing, and basically what it's doing is it helps the jaw actually grow. Now, why do you care about this? What does this have to do with your energy, being overweight, attention deficit? What does it have to do with that? When you sleep at night with your mouth open, right? Because maybe you had dental work, you had braces, you had teeth taken out, so this jaw never could grow properly. Hey Tracy, this jaw could never grow properly, and you're literally breathing with your mouth open all the time. What's happening is you're not getting the good oxygen. So this a lot of times will lead to snorers. How many people snore out there, right? And we're, just use the Breathe Right strip, or let's get a CPAP. And absolutely, if you have sleep apnea, you need to get a CPAP, because sleep apnea in these problems, snoring, will almost always lead to sleep apnea. Sleep apnea will cause you to have circulation and serious health problems. It's a big deal. it is a very big deal, right? But there are answers, especially for kids and even adults now. So it's a new science. It's called Fluoridonics, and it really addresses not only the jaw, but how we position ourselves, right? We're at computers all day long now. Our kids are at devices all day long, and us, right? We're staring down at this. And what's happening is we're really causing the underdevelopment of the jaw. So my daughter, perfect example. And when I will try to get you some videos too, so you can see this, or some video or pictures of her before and afters. My daughter was always struggling with a lot of sinuses. How many of you struggle with sinus infections, sinus congestion, you have a hard time breathing and stuff? It was like every other month, right? Now that happened to me as a kid, is that I had terrible allergies and things like that. But we've cleaned up our diet and we have good solutions for that. Hey, Roxanne from Missouri, woohoo! But so my kids don't have near as enough, you know, they've never had an antibiotic. They're never had tubes in their ears, right? We have chiropractor, we have all these things. But my daughter kept getting this. I'm like, you know, what's going on? What's going on? And I'll tell you, when she was a baby and I would get her adjusted, it would clear up just like that. So anyway, we saw Dr. Graham here in Hattiesburg, Mississippi. He's one of the only Fluoridonics dental, not physicians, but dentists in the area, and really, really, really knowledgeable. So we took both kids, right? She's the most compliant. She's been doing this, and you could see like her jaw and how she held herself and stuff too. Her jaw was more like this, and I'll see if I can find some pictures in here at least so you can see these kids. And so since it's been a little over a year, maybe a year and a half now, a year and 4 months, she has been wearing this. First, it's a habit trainer that retrains you to breathe through your nose, right? When you close the mouth, and this is why with breastfeeding children, in some cultures, they would actually close the baby's mouth after they would, you know, stop feeding. The mothers would just hold their mouth so that they would learn to breathe through here, but actually grow the sinuses. Have you ever heard or know someone has small sinuses? I do, right? I have family members. They struggle a lot with sinuses. You need to breathe through the nose. Now, why is that so important? Well, it's important for allergens, right? It's important for because the nose and the nasal cavity cleans a lot of things out, and it's important for those sinuses to be big and to grow big. So once she started this Fluoridonics, you could see her mouth, her teeth moved apart more. There was more room for her jaw started to grow, and she has rarely had any of those sinus problems. Now, I think she had maybe one in this year and a half, maybe two, but it was nothing like before. Okay, can you see this picture? Can you see how the jaw is very underdeveloped here? And you can see in this picture when she was younger how her mouth is naturally open. So those are things that you want to look for, is like, how are you sleeping? How is the mouth open? So mouth breathers, okay? Mouth breathers. Back in the day, right? In posture is so important, right? If we go back 50, 60, even 100 years ago, right? It was like, stand up straight, hold yourself back, hold your body, and we have lost that. We've absolutely lost that. Okay, all right, here's another example of an individual. You can see, right? See the chin that's very far back? That's an underdeveloped jaw. Underdeveloped jaws will cause crowding of the teeth. The teeth won't look so good. Again, underdeveloped jaw. Okay, so what is the epidemic and how did this happen? Oh, and this is a very sad story too. Okay, so when you are a mouth breather too, you will have much more teeth infections. And many of you know my friend Victoria Willoughby had a lot of stress. She had a tooth that was bothering her, infection, almost killed her. Literally was at her bed and her body went sepsis. It was very bad. And in I think it's Maryland, DeMonte Driver, he died in 2007 of age 12 after an infection from an abscessed tooth spread to his brain. Sadly, we might conclude from the available photography that he was a mouth breather, right? Mouth breathers are going to have more issues with their teeth. And in addition, our diet, right? So our diet has become soft. Fast food is softer, right? What was popular when my kids, especially Joshy, I know I gave him a bunch of those little squeezy things, right? Fruits. Oh, well, I'm giving him spinach in there and an apple, or spinach and sweet potato. And what that's done, for those of you who know the paleo diet or whole foods diet, it's caused our teeth not to be able to grow, and our jaw to actually develop like it should. Actually, you know, ripping that steak off, or eating things that are hard. And us as moms, right, we want to cut up everything. We want to cut up that apple and all those things, when the kids really need to be chewing on hard things. And if you have a sensory disorder kid, right, you got maybe just soft foods or things like that. So there's a lot of issues with that. But back to attention deficit disorder. So the feeling, and they're seeing a lot of research with this clinically with mouth taping. Have you heard of mouth taping? Actually taping. And this is common for kids on the spectrum, kids with attention deficit, all of that. It's just taping the mouth like this shut for periods of time, and or even at night. And what that does is when you breathe through the nose, it creates like a nitric oxide, which kind of opens everything up, helps the circulation. The brain gets more oxygen. You get a deeper sleep. So it's not just the quality of sleep, right? Because you and I have some special things that help people actually get to sleep, right? If you work with me, I can share with you what some of those things are, help people get to sleep. But the quality of the sleep has a lot to do with this epidemic of mouth breathing and this underdeveloped jaw. So anyway, in this book, they go through, you know, all of the things that I just shared with you. But what can you do, right? What can you do? Sleep breathing disorder symptoms in children may include snoring, pauses in breathing, restlessness, abnormal sleep positions. Behavioral problems such as attention deficit hyperactivity disorder may result. Note the open mouth. And so I'm really seeing it as my son is developing, like how small his jaw is. So he's got to get more compliant with this. So sisters with similar genes who were instructed to close their mouth, one succeeded and the other one did not. Neither of them had any treatment. Note the obvious differences in their teenage years and facial development. Okay, so let's see this. Okay, can you see the more developed facial development versus not? Chewing also influences how the face is formed. So children begin to eat solid foods, parents should teach them good chewing habits. Of course, it means spending time with kids, all right? Posture, as we outlined in Chapter 5, proper oral and perhaps overall posture is crucial to healthy oral facial development. The ideal oral facial resting position entails three things: lips closed, tongue on palate, so the tongue is actually up, the tongue on palate, and teeth touching lightly together, right? Teach your children when not eating or talking to rest their mouth closed. Start immediately after birth. Close your baby's lips lightly with your fingers for a few seconds when he finishes nursing. At the very worst, it's a harmless action, and future studies may show it has considerable benefit. Awesome. Okay. So Dr. John Mew is the founding father of orthotropics, which covers posture-related issues very well, and I guess you could call it Fluoridonics as well. But just, it's such a good book. There's different breathing techniques, which is like the mouth taping, how important it is if you do have allergies to like correct them very quickly. That's why looking for food sensitivities and things like milk, which are a big culprit in milk and sugar, right, are big culprits in allergies. That you really, really, really want to look into those things and make sure that you've eliminated them if you are a person who has allergies, because you will always be tired. There will be, different. So, checklists of what actions to take to protect children and adults from oral facial health epidemic. Breastfeed for at least a year, exclusively for 6 months if possible. Avoid bottle feeding during the period, even if bottled breast milk is if possible. Do not use a pacifier until weaning is complete. And now, I can share with you too, both my kids, I couldn't breastfeed them very well at all. So it's no wonder they have some of these issues too. So, but also don't feel bad if you didn't do these things. Teach children to keep their mouths closed when not eating or talking. Lightly pinch a nursing infant's lips closed for a few seconds when stops nursing. Wean onto foods that require chewing, watching for choking. Pay attention for toughness of foods and encourage thorough chewing. Help them practice hard chewing with tough chewing gum. But when you get the healthy starts and the Fluoridonics, you can't chew gum. Avoid most commercial baby foods. Check children's sleep habits, looking for mouth breathing and signs of disturbed slumber. Treat any signs of stuffy nose or snoring promptly. If congestion persists, think allergies. Encourage steps like thorough hand washing to limit nose-cold transmission of viruses. Check child care facilities for sanitary procedures. Pay attention to baby's posture, especially when it is being transported. Limit slouching and head forward posture over computers, phones, and the like. Try GoPex or Butico training according to the perceived need. We're looking to look into GoPex. I will do a video on that next. Seek professional help promptly if you detect there's any symptoms of oral facial health epidemic. So here's some positive results from Fluoridonics. Let's see what a difference they make. How about this kid? Big difference, huh? Big difference. I think there's a couple more in here. But again, look for that open mouth posture. Really, really important, I think. So this is, again, my kind of review on this, but to just make us all aware of, this is a serious thing. It's coming to the forefront. Now, the problem is, oh, here's another good success story. The problem is that there is a lot of money in the dental industry when it comes to braces. Braces have gone down in price, and people want straight teeth, and they want their kids to have it like that. And I would encourage anyone who's looking at braces to look at the Healthy Starts program, look at Fluoridonics, know all your options. And that's basically what they're saying too, is that in the dental industry, it should be required that we know all our options, like know what is available for us. I remember kids with those full-on head braces, and when I went to chiropractic school, they said, oh yeah, if a kid had one of those full-on head braces, most likely they're going to have scoliosis, because it didn't allow the cranium and everything to move like it needs to move. So chiropractors have known that this has a lot to do with our health, the way that the cranium moves, the way it should move, posture, all of that. We've known that for quite a lot of years, and as I pull my shoulders back as well. So anyway, there is a serious epidemic, and it has a lot to do with our Western society. And what you can do, start eating harder food, right? Start thinking about, do I breathe through my nose or mouth? Should I try a little mouth taping, Scotch tape, something as simple as that. If you're already using a CPAP, yes, absolutely continue to use it, but look at your habits of your posture and foods and all of those things as well through that. And there is a whole new dental Fluoridonics for adults too, and it's getting some good results too. So just wanted to educate you, wanted to do my book review again on the Jaws. And if you're watching this live, don't forget Friday we have a Healthy Women's Chat, all things women, weight loss, the lymphatic challenge that we're doing, as well as cellulite. We're going to talk about a little bit of hormone stuff. It'll be a good class that's live on Zoom. I get you the registration for that, or you can also get the replay if you register. All right, talk to you later. Have a great day. Bye-bye.